Welcome to Lecto. Today we are going to discuss carbonic anhydrase inhibitors. Carbonic anhydrase enzyme is very much important and it is actually present in different parts of our body like kidney, eye, blood and brain. So carbonic anhydrase inhibitors show the diuretic effect. So we categorize it into the diuretics. In this lecture, we will discuss the mechanism, therapeutic uses and the adverse effects of the carbonic anhydrase inhibitors. And the important inhibitor is the acetazolamide that actually affect all the carbonic anhydrase enzyme which is present in our body. So let's start. Before we discuss the mechanism of the carbonic anhydrase inhibitor, we should know the basic important points. So here are the thing. If you see that the carbon dioxide and the water combine and it will result in the formations of the carbonic acid H2CO3. This is the carbonic acid. And this is actually the reversible process, and in this case you will see this happens in the presence of the enzyme, and that is actually the carbonic anhydrase. So conversion between the carbon dioxide water and the carbonic acid is with the help of the carbonic anhydrase, and when the carbonic acid is produced, then it will dissociate into the hydrogen ion and the bicarbonate ion HCO3 negative. Hydrogen and bicarbonate ion, and this is the spontaneous process, and this is also reversible process. So if you see here, like this is the structure of the nephron and different parts like the glomerulus, proximal convoluted tubule, loop of Henle, distal convoluted tubule, and last is the collecting duct. So these are basically the different parts of the nephron. So we focus on the proximal convoluted tubule. So if you see, like in the filtrate, if I say that the hydrogen and the bicarbonate HCO3 ion is present in the filtrate, that actually comes from the glomerulus. Okay. If we see these ions combine spontaneously, and it will result in the formations of the carbonic acid H2CO3. Okay. This carbonic acid will convert into the carbon dioxide and water with the help of the carbonic anhydrase enzyme. So here you can see this is the smiling face. This is actually the carbonic anhydrase enzyme. This enzyme is actually involved in the conversion or in the formations of the water and the carbon dioxide. This is actually involved. This enzyme is actually involved in the formation of the water and the carbon dioxide. Now, this carbon dioxide, which is actually present in the lumen, will diffuse into the cell, epithelial cell of the tubule. And in this case, you will see now the carbon dioxide combined with the water that is actually present in this cell, and it will result again in the formation of the carbonic acid. Now you also require the carbonic anhydrase inhibitor in that situation. So they again form the H2CO3 with the help of the enzyme, and that is the carbonic anhydrase enzyme. So if you see that the carbonic anhydrase enzyme is actually present in the cytoplasm and on the membrane of the cell at the apical side of the cell. And if you see now, this carbonic acid will again dissociate, and if you see here, like it will dissociate into two. Here like this one, H positive and bicarbonate ion. So here is the H positive and this is the HCO3 negative. This is the bicarbonate ion. Now this bicarbonate ion will move into the bloodstream. So if you see here, like this bicarbonate ion that is formed here will move inside and move into the blood and HCO3 negative. Okay, and along with that you will see the sodium will also move into the bloodstream. Now the question is, where does this sodium comes from? So actually if you see like this one, this is the hydrogen ion. This hydrogen ion which is produced inside the cell will move outward, and exchange for that you will see the sodium will move inward. That is actually present in the lumen. So this is the exchange between the hydrogen and the sodium. Now if you see, this sodium has two ways to enter into the bloodstream. It goes through this way, it goes through the bicarbonate ion, or it has another pathway. It can goes into the blood with the help of the sodium potassium ATP pump. So here is basically the sodium move inside, and in exchange for that you will see the potassium move inside the cell. So this is the two pathway of the sodium. It can goes into the blood through the bicarbonate ion or in exchange for the potassium. So this is basically the normal process that actually happens in the proximal part. So actually carbonic anhydrase inhibitors affect these carbonic anhydrase enzyme. Let's say if I block these enzymes, carbonic anhydrase enzyme, then what will happen? Then the whole process will stop. If you see here, like these are the ions, okay, they form the carbonic acid, okay. Now this carbonic acid cannot convert into the water and the carbon dioxide. This will stop. Carbon dioxide cannot move inward because there is no carbon dioxide in the lumen, okay. Now carbon dioxide and water cannot convert into the carbonic acid in the cell because the enzyme that is involved in the conversion is not present, or the enzyme carbonic anhydrase has been blocked. So if you see, then there is no H positive and bicarbonate ion will not produce. So in our process you will see that sodium hydrogen ion cannot move in the lumen, and in exchange for that sodium cannot enter. It means that the sodium will remain in the lumen and hydrogen will remain inside the cell. So this is the process, and in that situation, in whole process, the important thing which you have to remember is the bicarbonate ion will lose in the urine. Here is the whole process that ultimately form the urine. So ultimately you will see the increase in the concentration of the bicarbonate ion in the urine and decrease concentration of the bicarbonate ion in the blood. So this point is very much important. Okay. Now the important thing, if you see like the MD, this is the important mnemonic, that is metabolic. In the metabolic state you will see the direct relation. So if you remind that the alkalosis and the important term is the acidosis. Okay. In the acidosis we see the pH will be low, and in alkalosis we see the pH is high. This is the point. Okay. Now if you see that HCO3 negative, the M metabolic, D for direct relation. So if you see that in the acidosis we see the pH is decreased, then it's mean that the bicarbonate ion concentration should be decreased. So if the bicarbonate ion concentration is reduced, then obviously the pH will be reduced and it goes toward the acidic condition, and that is called acidosis. In alkalosis you see that the HCO3 negative bicarbonate ion concentration is high. So pH will be high. This is the direct relation. Bicarbonate concentration increase, pH will also increase, and if the pH increase, the condition goes towards the alkalosis. So this is the important point. So in that situation, if you see, I say that the bicarbonate ion concentration increase in the urine, then it's mean that if the bicarbonate concentration increase, then pH increase and the condition goes toward the alkalosis. So urine will be alkaline in nature. Okay. And if the bicarbonate ion concentration decrease, so condition goes toward the acidosis. So bicarbonate concentration decrease in the blood, then obviously the pH will be acidic and it goes toward the acidosis. The blood will be acidic, urine will be basic. So this is the important point. Now, and the important thing you have to remember, in the proximal part you will see the two excretory system, acid excretory system and the base excretory system. So important thing, first of all you will see the acid excretory system and the base excretory system. Two system. Actually acid and the base move from the blood and enter into the lumen. It is actually occur in the proximal part. So if I say that the uric acid move from the blood and enter into the lumen in the proximal convoluted tubule. This is the condition. And if I say the base, like the keratin is actually move from the blood and enter into the lumen. So there are two basic excretory system, acid excretory system and the base excretory system, that is actually present in the proximal part of the nephron. So this is the mechanism of the carbonic anhydrase inhibitors. Next we will discuss the therapeutic uses when we use in carbonic anhydrase inhibitors. So this is actually, if you see, this is actually the diuretic effect. How? We see that these ion sodium and the bicarbonate concentration increase in the tubule, then obviously the water will retain in the tubules and obviously the urine, volume of the urine become increase, and that is the property of the diuretic. But it is mild, carbonic anhydrase inhibitor shows the mild diuretic effect, but it shows other effect as well. So if you see in the glaucoma we see that the intraocular pressure increase. So this is the important point. In the eye we see the pressure that is created by the humor in the eye increase. Okay. Now if you see, like this is the lens, and at the front side you will see the aqueous humor, and at the back side you will see the vitreal humor. So, and in that situation you will see this is the ciliary body. This point is very much important. In the ciliary body you see the carbonic anhydrase, that is the enzyme, and that is involved in the conversion of the carbonic acid and carbon dioxide and water. Now this process actually happens in the ciliary body. Okay. Now and keep remember that the aqueous humor produced by the ciliary body, actually aqueous humor produced in the ciliary body and enter into the front side of the eye. Okay. If you see that if we take the carbonic anhydrase inhibitors, then what will happen? Then the production of the aqueous humor will reduce. Okay. Now if you see, if we take the carbonic anhydrase inhibitors, then what will happen? Then the process of the carbonic anhydrase enzyme in the ciliary body become reduced, and as a result you will see the HCO3 bicarbonate ion production will be reduced, and there is low amount of the bicarbonate ion in the aqueous humor chamber. So as a result you will see HCO3 negative production will low, water move into the front part or aqueous humor chamber will also be reduced, and as a result you will see the aqueous humor will also be reduced. So if the aqueous humor reduced, then the intraocular that is present inside the pressure generated by the humor will reduce, and the chances of the damage of the nerves will be reduced. So this is actually the basic process, and in that situation we use the carbonic anhydrase inhibitor in case of glaucoma. So this is the important point. So important thing you have to remember, we can take the inhibitors orally and the topical. If we take the inhibitor orally, then it affects the all the carbonic anhydrase that is present in our body. But if we use topically, that is a specific part of the eye, then it show its effect only the specific part of the eye. So this is actually the important things. And in the topical you will see the dorzolamide and brinzolamide. So these are basically the two inhibitors. Next, altitude sickness. So when someone goes to the altitudes, then it causes some problems like nausea, dizziness. So these are basically the symptoms of the altitude sickness. Then we can also treat the altitude sickness with the help of the carbonic anhydrase inhibitor. How? As we know that the cerebrospinal fluid in the brain, cerebrospinal fluid is produced from the choroid plexus. So choroid plexus is actually involved in the productions of the cerebrospinal fluid. And we also know that the carbonic anhydrase enzyme also present in the choroid plexus, and it is actually involved in the productions of the cerebrospinal fluid, same like this one in the ciliary body. Same process happens in the choroid plexus. So we know that the carbonic anhydrase inhibitors involved in the productions of the bicarbonate ions. So in the you also see that the HCO3 negative bicarbonate ion produced, and along with that you will see the water moves along with that, and ultimately you will see the production of the cerebrospinal fluid. If we stop or if we inhibit the carbonic anhydrase inhibitor, then the bicarbonate ion concentration will reduce, water will also reduce, and ultimately cerebrospinal fluid will reduce. So this is the situation. Now the important thing, in that situation I say the bicarbonate ion concentration reduce. If the bicarbonate ion concentration reduce, then it goes toward the acidosis. So in that situation the cerebrospinal fluid will become acidic, and in that situation you will see cerebrospinal fluid become acidic. Now it result in the hyperventilation. So when the cerebrospinal fluid in our body become acidic, then it result in the hyperventilation. So this is the process. Actually, from the choroid plexus we see the production of the cerebrospinal fluid, and the whole process happens with the help of the carbonic anhydrase enzyme. Produce the bicarbonate ion from the bicarbonate ion you also see the involvement of the water, release of the water from the cerebrospinal fluid in the ventricles, and ultimately you will see the production of the CSF. If we inhibit the carbonic anhydrase inhibitor, then the bicarbonate ion will reduce, water will also reduce, and ultimately the cerebrospinal fluid concentration or the amount of the cerebrospinal fluid will also be reduced. So in that situation we can treat the altitude sickness with the help of the carbonic anhydrase inhibitors. Last we will discuss the adverse effect of the carbonic anhydrase inhibitors. So the important thing, as we have discussed, that we see the metabolic acidosis. Why? Because HCO3 bicarbonate concentration ion decrease in the blood. So if the bicarbonate ion concentration decrease, then it goes toward the acidic condition, and that is the acidosis. Next, the important things. We also see the potassium lossing. Potassium loss with the help of the carbonic anhydrase inhibitors. How? So if you see, like sodium concentration increase in the tubule if we use the inhibitors, then this sodium move here and reach the collecting tubule, or you can say collecting duct. Then in the at the principal cell, you see this sodium concentration high in the tubule, then it will rush into the cell, and in exchange for that you will see the sodium moves outward. So this is actually the process that happens in the principal cell, and lot of potassium loss from the cell, and ultimately the potassium loss in the urine. So that's result in the potassium losses in case of the carbonic anhydrase inhibitors. And we know that the lot of the bicarbonate present in the urine. So, and the condition HCO3, bicarbonate present in the urine, and the condition goes toward the alkaline. So in the alkaline urine, the chances of the formation of the stone become enhanced. So you see the kidney stone. Chances of the formation of the kidney stone become enhanced when you will see the alkaline urine. So this is the case. And next adverse effect is the paresthesia. Paresthesia is just like a feeling. You feel that the lot of ants are running on your hands, on feet. So this is actually the paresthesia. And last, most important thing which you have to remember, you will not prescribe any carbonic anhydrase inhibitors in case of hepatic impairment. If there is a patient who has improper liver, or liver is not function properly, then you will never prescribe the carbonic anhydrase inhibitors. Why? So if you see in the hepatic impairment, if I say the hepatic cirrhosis, then what will happen? In case of hepatic cirrhosis, liver is not function properly, then the lot of ammonia will loss in the tubule. So in the liver impairment, you will see the lot of ammonia NH3 loss in the tubule. Okay, now in that situation you will see, in the normal situation you will see it combines to the H positive and form the NH4 positive ion. Now this NH positive ion is trapped in the tubule, and it will ultimately loss in the urine. This is the case. I repeat, in normal situation, ammonia move into the tubule, it combine to the H positive and form the H ammonium ion. This ultimate trap, because the normal neutral molecule can easily cross the membrane, plasma membrane, but the ions has somewhat difficulty in crossing the plasma membrane. So in that situation, now the ion charge will retain in the tubule and it will loss in the urine. Okay. Now in the, when we use the carbonic anhydrase inhibitor, then what will happen? So if we see like this way, this H positive ion will not be present in that case. Why? Because in this case, this ion is not produced in the cell. If this is not produced, then it will not loss into the tubule. So in that situation, H positive is not present. Only you will see the ammonia, NH3. Now if there is no ammonium ion and only the ammonia is present in the tubule, then it will reverse, absorb again into the blood. So here is the situation, like here is the blood vessel, and now the ammonia will again absorb into the blood. So ultimately you will see the blood ammonia level will increase. So ammonia level will increase in the blood. So this is the important point in case of hepatic impairment and you are taking the carbonic anhydrase inhibitor. So ultimately the blood ammonia increase, and that is called ammonemia, high ammonia level in the blood, and that ultimately cause the hepatic encephalopathy. So this is the condition. Okay. So this is the main cause that why we do not take the carbonic anhydrase inhibitor in case of hepatic impairment. In hepatic impairment, we see the lot of ammonia loss in the tubule, but it will not attach to the H positive ion because there is no H positive ion. And H positive, why H positive ion is not present? Because of carbonic anhydrase inhibitor. Now this ammonia will again ultimately move absorbed into the blood, and ammonia level increase, and ultimately you will see the hepatic encephalopathy. That is another problem. Hepatic impairment is already present in our body, and due to this, by the taking of the carbonic anhydrase inhibitor, you also see another problem, and that is hepatic encephalopathy. So this is all about the carbonic anhydrase inhibitor. If you have any question, then you may ask in the comment section. Thank you so much.